space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam. I am a board-certified plastic surgeon in Houston in the Woodlands area. I'm so happy to have you back with me today. This is going to be a solo talk, so I definitely love being able to talk about different areas of plastic surgery. And one area that everybody always wants to know about and hopes that never exists with plastic surgery is scars, right? So unfortunately, there is no such surgery as a scarless surgery. There is always going to be a scar with the surgery. The goal as a plastic surgeon is to make that scar look as good as possible. So today I want to share with you some of the things that I personally do that are all evidence-based. And I say that because there is so much out there. There are things that you're going to find in your pharmacy. There are things that you are going to find on TikTok. There's things that you're going to find on the web that are going to tell you that they are the end-all be-all. And really, at the end of the day, there's only certain things that have been studied that have been proven to improve the appearance of your scar. So let's start with, how does a scar get created? At the end of the day, a scar is a break in the skin. Whether that is formed from a scalpel, it is formed from a needle, or is formed from some other device, that is what creates that first incision, is what creates a scar. Some people just scar beautifully. Some people don't. So what are the factors that we have to think about when we think about how somebody's going to scar? Number one is ethnicity. And some people may say, gosh, like my ethnicity shouldn't necessarily be the only predictor to my scar. And that's true. But your ethnicity does play a big part in how you heal and how you scar. Specifically, what your skin pigment and color and background are. Those of us with darker skin like myself are going to have a tendency to hyperpigment and potentially even have thicker scars. Those of us who are much more fair-skinned may have a very minimal scar long term. Initially, your scar will look like it is a different color than its final color, and that is due to the effects of your natural melanin basically filtering out the effect of increased blood flow in that area. If you're very fair skinned, that's going to come up as pink or red because you don't have a lot of color to really obscure the shade of your natural increased blood flow in that area. If you have a little bit darker, more Mediterranean type of skin, you're going to have almost a purplish color to that scar for some time. And then if you have more East Asian black skin, then you're going to actually have more of a brownish color to your scar. Now, when I say that's temporary, it's because it is. We temporarily have an increased amount of blood flow in these areas. And then over time, as the scar matures and heals, that blood flow goes back to a more normal amount. And so that increased pigmentation for most will disappear. But it does not for everybody. So that's why your background, your ethnicity can play a big part of your scar. From a surgeon standpoint, what I do in the operating room is really important. So that means making very clean incisions, avoiding too much heat really close to the surface of the skin, especially in darker skin individuals. All of these things will make your scar heal better because we have to be very gentle with the tissue and how we're handling it. If we're not very gentle with the tissue, if we put a lot of heat in areas that we really shouldn't be putting heat, then we have increased the potential for a thicker scar and a more discolored scar. Finally, after the surgeon's done their part, we have our background that we always have to take into account. What is the final healing part? And the final healing part is you as a patient, right? So you have to follow all your post-op instructions. A scar will heal well in most people if you follow all those instructions. So that means not doing too much lifting afterwards. It means resting. It means not providing feedback to your brain that there's so much movement at that scar that I now have to make the scar thicker because there's a worry for the scar to open up. Now, everyone will give you different levels of restrictions, but in general, if you have surgery, they're going to tell you need to wait at least 6 weeks before you start stressing any part of your surgery. That is actually based on a scientific study that's showing by 6 weeks, our scars have about 80 to 85% of their final strength. So at that point, we can start putting more, we can start loading our scars. We can start putting more tension on and moving them, and then we're not potentially affecting the aesthetic outcome of the scar. But if you don't listen to that, if we start pushing things too quickly, then the feedback our brain gets is, gosh, we need to make the scar stronger. Stronger often equates to thicker and potentially less aesthetic looking scar. So we've taken into account that your background plays a big part in your scar. We've taken into account that your surgeon's technique takes a part in the scar. The third thing we've taken into account is your participation. Your participation is twofold. So one is following all those post-operative instructions, but two is doing post-operative scar care. Now, I'm not here to tell you that there is a perfect way to do this because we are continually learning about better ways and improvements in scar care. But I do, like I said, practice evidence-based medicine, and I try to do things in my post-scar care regimen that I know are really going to work for my patients. So first and foremost, we want to have as little tension on the scar. So going back to where I talked about your surgeon doing everything they can, that involves also how we close things. We want to close where tension is on the deep part of the tissues and that the skin is basically kissing at the closure. So that most superficial layer of your suturing has nothing to do with holding things together. It's literally getting things lined up. It is that deep tissue and those deep stitches that really provide all the strength until your body replaces that with your own collagen and scar tissue. So we talked about evidence-based things. So these are the things that I have read about and the things that I have seen in my practice that work well. First, I like to do taping. I like paper tape. I don't use things like steri strips, butterfly strips. My reasoning for that is that the tape is, paper tape is very minimal adhesive on it. I find that people don't really have reactions to it. And it can stay on for weeks at a time when it's applied with the skin prepped really well and dry. Now, a lot of people will swear by things like butterfly strips and steri strips. It's just in my hands, I haven't found that they stay on that well. And some people will have issues with the adhesive within them. So that's my reasoning for why I prefer paper tape over not. But paper tape has also been very studied, and they have found that it is one of the best and most economical ways to improve the appearance of your scar. I generally will use paper tape on areas where I don't have curved surfaces, areas where I may not be able to use other products that I like. And like I said, it can stay on for a very long period of time. And it's, at the end of the day, sometimes it's nice for you to know that your scar is protected beneath a layer and that you may not by mistake scratch or anything like that. So I do use more than one layer of paper tape often. The next thing that I really like to use is silicone. Medical grade silicone comes in a lot of different forms. Silicone can be come in a cream, it could come in a gel form, it can come in a silicone tape. Depending on the place of the body, I'm going to choose different parts, different types of silicone to use. I think that the cream works best in areas like the arms, around the areolas, around the belly button, places that it's just really hard to get a strip to stick. But I really, really like the silicone strips. I think that they provide nice pressure. Again, studies have shown that medical grade silicone really does work and improves the appearance of scars. We're not sure exactly why. We think that potentially it may be due to reducing the oxygenation of the tissue by blocking that somewhat. And as a result, you don't get as much growth of the scar. It may actually be due to the pressure of the silicone on the scar as well. So there's a few different factors, but we do know that studies have shown that it can improve this. Now, you can buy silicone at your pharmacy. You can buy silicone online. You can buy silicone at your doctor's office. But like I said, there is a difference between silicone and medical grade silicone. The big difference that I can tell you is that medical grade silicone is guaranteed to be what you need for your scar. If you're buying it from other places and other non-medical places, we don't know what the quality of the silicone is or if it's mixed with other things. But that being said, if you can't afford to get medical grade silicone, I do think that using some silicone, even if it might not be pure silicone, is better than nothing. I think that the final factor that I think that plays a lot with scar care is massage. Now, massage has been around for as long as you can imagine. I used to have an attending in training who used to say that you could rub ketchup on your scar and it wouldn't matter because it's the massage, not the product, that helps with the flattening of the scar. Up until about 6 months, your scars can still be mechanically flattened. So what that means is the pressure from consistent scar massage, you are literally flattening the cells in your body. Now, it is hard for some people to do this because it does require consistencies. If you do this for 2 hours once a week, it is not as good as 5 minutes every single day. It is that consistency that will get you those results. And if you're not a person that can even remember to take a vitamin in the morning, then maybe scar massage isn't your best option. But like I said, it's simple, straightforward. You don't need anything fancy with it. There are a lot of products out there that people buy. I will mention Mederma as one of those products because it's a very popular product and people ask me about it a lot. But truthfully, I, like my attending, very much believe that it is the actual massage aspect and not necessarily what you are massaging it with that's going to provide you with those results. Those three things are, again, evidence-based medications or treatments that have been proven to work. There are newer products coming out there, and I want to mention some of them. Red light therapy. So there are a lot of people that have interest in using red light therapy in the scars from the get-go. I don't think there's any harm with using red light therapy. I think that there is a lot of studies that still need to be done. But what we have seen is improvement in fine lines and wrinkling, improvement in pigmentation, all this due to reducing an inflammatory cycle. And so because of that, I think that there is some benefit. You're not really putting your body at risk with it. People are using it a lot for facial aging, so it does make sense to use it on scars as well. I generally will recommend that you don't start using that until you are done with any sort of topical scar therapy, because if you have that on there, then your red light therapy may not be penetrating the same way. Other things that have come onto the market that are newer are a lot of tension relieving devices. My personal favorite is a device called the Bridget's. It was developed by a board certified plastic surgeon, Dr. Monty Eves. And it is a very smart and simple device that basically takes tension off by placing a little sticker that looks like a bridge over top of your scar. Again, these are used for about 6 to 8 weeks. And again, if you go back to what I talked about before, it's because that's the amount of time we need to get that initial strength for you to be able to kind of get back into your normal activities. This is a device that has been studied and is continuing being studied for and showing, in my practice, quite an improvement in the appearance of scars, especially in high tension areas like in the arms and in the thighs. It works really well for vertical areas, but not so much on horizontal areas. But maybe in the future, they will come up with a new design. I am excited to let you all know that the next podcast we have coming out will be with Dr. Eves, talking about his device, how he created it, and also talking generally about how does one become a medical device inventor. So that will be an exciting one for you guys to tune into. I digress. So all these things put together help our scars look really good. So there is no magic wand. I have actually seen some videos on social media showing these creams that you rub in and magically your scar disappears. Don't buy it. Don't waste your time because it absolutely is not going to help you. Scars take time. Healing takes time. Your body is not fully healed for almost a year, and some people take even more. Doesn't mean you can't get back to things. It doesn't mean your scar can't look good before then. But just realizing that it does take time and that surgery is just a small part of it. Scar care afterwards is a big part of things looking really good, and that involves talking with your plastic surgeon, listening to their advice, and you being an active participant in your surgery. So I hope this was helpful, gave you some insight into what we do and why we do it when we're trying to get your scars to look good afterwards. Everything I've talked about today are things that I personally use. There are probably many other things out there. So if you are working with a different plastic surgeon, make sure to listen to them because if they're recommending it, it's likely something that's worked really well in their hands. So no scarless surgery, but we can get surgery that has very faint, almost faded scars that looks beautiful and gives you the confidence afterwards that we all are seeking out and deserve. So thank you so much for tuning into the Confidence Doc podcast. And again, stay tuned for next week when we have the inventor of Bridget's on.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.